Drawing conclusions from experience versus experiments. Introduction. Concluding is one of the most critical aspects of nursing care in nursing practice. The conclusions made depend on the available evidence. To conclude, one is either guided by one's experience or the results of an experiment carried out before. There is a difference between concluding using experience and drawing conclusions from experiments. Conclusions should be based on the evidence and previous knowledge, not mere observation. The difference between concluding experience and concluding experiments. One of the significant differences between the two is that when drawing conclusions from an experiment, it is more likely to be inductive. Experiments are based on observations of samples placed under certain conditions to give results. The premises given might be true, but this is not always the case with a conclusion. In this case, experiments provide partial evidence for the conclusion. Alternatively, the elements considered in the experiment may not consider all factors affecting the phenomena. Drawing conclusions from experience offers one a chance to communicate one's thinking and logical reasoning. On the contrary, if one draws conclusions from experiments, they have to be referred to or guided by the results and discussions of the experiment. Too much reliance on experiments does not adequately develop the nurse's critical thinking. Experience enables one to reconsider other possibilities that are not clearly stated in studies or findings. They introduce their individual meaning to the context by linking it to previous knowledge. Drawing conclusions from experiments also gives nurses a clear reference when drawing their evidence. A reliable experiment establishes the cause and effect relationship, thus leading to a succinct and clear conclusion. Students or nurses use suggestions or evidence from the experimental data to develop evidence when the facts are not directly stated, and they must, therefore, dig deeper into the details to obtain other meanings. As such, the conclusion made is more or less likely to be uncertain. Experiments guide the nurse towards inductive reasoning by providing the potential to come up with new knowledge. The premises might be true, but the conclusion may not always be accurate. This can be attributed to factors like wrong observations during controlled experiments. In addition, it is not always possible to carry out every experiment since some could be unethical and impractical. Experiments are also expensive and time-consuming. Hence, including all the variables needed to give results is impossible. Experience enables one to arrive at a conclusion based on the premises of an earlier evidenced phenomenon. Premises from experiments rarely translate to an entirely true conclusion. This is attributed to the fact that most experiments are not applicable in real-life situations. There is always the problem of induction and uniformity of nature. We can only assume that nature will remain unchanged in the future so that the findings remain relevant. There is also the issue of confounding factor, where no matter how good and persuasive the evidence is, there must be a flaw in the conclusion since the perspectives vary between people and conditions. The concluding experience is more inclusive since it combines facts, findings, and beliefs. When the nurse bases a conclusion on experience, they consider the outcomes and findings they have seen before to derive premises. Thinking is presented on facts such that a premise comes close to conclusion. In this case, prior knowledge and logical reasoning can address inadequacies in experiments. Conclusions made from experiments often require that the nurses make provisions for other factors that could be influencing the results. For instance, in an experiment on using aspirin for heart disease, a sample of 150 people who use aspirin and another 150 people who do not are taken. If their heart condition is examined and those using aspirin record lower risks, one cannot conclude that aspirin reduces the risk of heart disease. This is because other factors could affect the same, such as fitness and diet. Therefore, the premises may be true about the effect of aspirin on heart conditions, but may not lead to a proper conclusion. On the other hand, drawing conclusions from experience requires high skill and decisiveness. It also involves comparing emerging and existing data as well as evidence to arrive at a relevant conclusion. However, the biggest problem in this case is bias. The student or nurse should be objective when concluding an experience to achieve a relation between premise and conclusion. When concluding experience, there is an impact on the student's perspective, since a person's perspective is affected by experience. Students combine experiences, ideas, and information gathered earlier to conclude in this context. An experience-based conclusion is, therefore, self-contained because all the required information is available. As a matter of fact, experience is gained by attending patients, in-person and virtual discussions, inside and outside the hospital or school setting. Conclusion. The difference between conclusions based on experience and conclusions drawn from experiments is quite evident. Experience-based conclusion enables the student to put their perspective on the issue. It also involves drawing a conclusion based on evidence that translates to an actual conclusion. It is a combination of knowledge, beliefs, and experience. A conclusion drawn from experiments, on the other hand, allows the nurse or student to engage in logical reasoning. It also leaves room for further investigations as factors affecting the findings keep changing in certain areas. There should be a good mix of the two methods to achieve a premise that translates to a proper conclusion.